every Saturday at 11 a.m. This is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
Good morning, everyone. I can see more people joining, which is amazing. So I'll start off by introducing myself. So my name is Jess. My name is Dr. Jessica Fletcher Rogers, but that's a mouthful. So yeah, I just go by Jess. And I am a consultant psychiatrist. I work in Newham, in London, and I live in South London. More people are joining, which is awesome. We've got quite an exciting and important session today. I'm really honored to be joining and hosting the session today. So I can see more people are joining, which is really good. So just a brief overview. We will have a very important talk by Dr. Cathrine Mbema shortly on breast cancer, as it's Breast Cancer Awareness Month. And I just saw a message. Yes, please do let us know where you're tuning in from. Like I said, I'm in London, but I know that there are people all over the country, so please do let us know where you're tuning in from. So we'll have this talk, and as the talk is happening, please feel free to add your questions in the chat box, and then I will read them out after the session, and hopefully we can get as many of the questions answered as possible on this very, very important topic. So without much further ado, I just want to introduce our speaker for today. So we're delighted to welcome back Dr. Cathrine Mbema, who is a medical doctor and public health leader, and she's dedicated to tackling health inequalities and improving outcomes for not only Black but also minority ethnic communities. She's been a strong partner of Khan and has delivered a series of health hours in the past, which obviously we know help empower our community with vital knowledge. She's deeply committed to community-focused public health. Her work bridges clinical knowledge, public health strategy, and advocacy, ensuring that vital messages such as prevention, which we're going to talk about today, early detection, screening, reach those who need it the most. Like I said, she's a regular with Khan, and I believe other local health systems and voluntary sectors, in addressing barriers that can delay timely care and impact survival. Today, she'll be sharing her expertise and practical guidance on how communities can work together to change these outcomes, these kind of negative outcomes. I think one of the things that Dr. Mbema has raised awareness on is that Black women in the UK are more likely to be diagnosed with breast cancer in late stages. So I think it's important that we're having talks like this. So as I said, this is her third health hour with Khan, and the second time speaking about breast cancer. In previous sessions, she's highlighted the disparities facing Black women. But as we mark Breast Cancer Awareness Month, she's returned to focus on screening and prevention, and just practical steps on how to protect ourselves and support our loved ones. So again, without further ado, I've said that already, but then there's been a due, but without any further ado, please join me in welcoming Dr. Cathrine Mbema.
Thank you so much, Jess. Really, really lovely to be here again with you all as part of the Khan Health Hours, which I think is such an important um, way of us sharing knowledge and vital information with our community. So it's a pleasure to be back, and pleasure to be back speaking about a really important topic, as Dr. Jess mentioned, breast cancer. It's Breast Cancer Awareness Month. So the information that I'll be sharing today, you may have heard a majority of the content from when I came to a health hour earlier this year, but I wanted to reiterate some of the key messages and also talk a bit more about wider general prevention, so how we can keep ourselves well and healthy to both as both a part of prevention in terms of breast cancer, but then a whole host of other chronic illnesses as well. So I will start sharing my screen and we'll get started. And then after the session, we'll have an opportunity for questions and answers as well. It work here. I hope. Is the slideshow sharing? No, I'll stop sharing. I'll try again. Just bear with me. No.
We can see the slide deck on the side as well, though it's not showing, it's not presenting.
Let me see what I've done here.
Catherine, if you just do what you just did there before, there should be like a presentation icon in the toolbar in the top. So if you just share your screen again.
Let me share again. Yeah, this worked earlier. Apologies. Let's see what I've done. Is that working?
Yeah, it is. Yeah, in the top left, there should be top left.
I'll do that. Oh no.
There we go.
Yeah, that's it.
Oh, there. Okay, good. Apologies for that delay. Sorry, we practiced it earlier. Good. So, so I'll be talking about breast cancer and Black women in particular. And as just mentioned, I'm a director of public health, working in the London Borough of Lewisham in South East London. So today or this morning, I'm going to talk about just breast cancer overall in the UK. I'm going to talk specifically about breast cancer in Black women, what some research evidence says, and then what that means for us in terms of the actions that we can support each other to take, both in terms of screening, looking out for early signs and symptoms of breast cancer, and then that wider prevention, so how we can eat well, how we can remain physically active, manage our alcohol intake, etc., is all as part of prevention and being well. So breast cancer or cancer overall. So we know these unfortunate statistics about cancer that 1 in 2, so 50% of us or of people will develop some form of cancer during their lifetime. So again, it reiterates the importance of us talking about cancer prevention, sharing our stories, sharing our insights about how we can stay well, how we can prevent cancer, but if we are not able to prevent it, pick up signs and symptoms early enough so we're diagnosed and get appropriate treatment. So conversations like this are really important. In terms of the most common types of cancer, you can see them listed there, and breast cancer is the most common cancer in the UK. So it accounts for about 15% of all new cancer cases. So again, reiterating the importance of us talking about breast cancer this morning and having a whole month dedicated to breast cancer awareness in October. So if we look at the key statistics of breast cancer now, in the UK. So in terms of cases, and this is slightly older statistics, but around 50,000 new cases every year. In terms of deaths, about 11,000 deaths from breast cancer, unfortunate deaths. But in terms of survival, and I think it's really important to keep this in mind that though cancer, when people get a diagnosis of cancer, or we talk about cancer, we tend to think um, that's very negative in terms of the prognosis, in terms of, you know, what happens afterwards. But 76% of people survive breast cancer for 10 years or more. So that's really significant. And I'll come on to talk about it a bit later. But the earlier you are diagnosed with breast cancer, or the earlier the stage of the cancer when you are diagnosed, the much more likely you are to survive. And so picking up those early signs and symptoms is really critical here for survival. So key message here, that a breast cancer diagnosis, you know, it doesn't mean the end. You know, it can be survived. And if we pick up, the earlier we pick up the breast cancer and it hasn't spread to other places, the increased likelihood of survival. And then the final point here is about prevention, which I'll talk a lot about in terms of my profession, public health, that 23% of cases of breast cancer are preventable. So there are things that we can do to keep ourselves well and healthy to prevent cases of breast cancer. So that's cancer overall, breast cancer overview, and now looking specifically at breast cancer in Black women. So this slide takes data from a study looking at the percentage of breast cancer cases by what we call a broad ethnic group. So you'll see the categorization here. They are quite broad groups. It doesn't go into places of heritage, etc. It talks about the broad ethnicity, but it's looking at the relative proportions of cases of breast cancer by ethnicity. And you can see, looking across here, the annual average number of cases by broad ethnic group, the vast majority of breast cancer cases in women occur in white populations. And for Black populations, you can see I've put it in bold here. It's about 1.9%, just under 2% of cases each year are in Black women. So though when we are not more likely to get breast cancer in comparison to white women, we are, however, at a higher risk of late-stage cancer at diagnosis in comparison to other ethnic groups. And I'll come on to some data about that shortly. But first of all, I'll just talk about stages of breast cancer in case you haven't heard of that terminology before. So when you're diagnosed, first diagnosed with breast cancer, you will typically have a number of tests and scans, and this is to give us, or the clinician or doctor looking after you, some information, firstly about the size of the cancer and whether it's spread. So if you look at some of the diagrams on this slide, you'll see some examples of what we mean by the size. So the top diagram there, you'll see an example of a breast cancer about 2 centimeters in size within the breast. So that gives us some information when we look at the size. And then the spread, we also want to do some scans to see if it has spread to any other places. So the brain, lungs, liver, bone. And those two combined, both the size and the any spread, will give us what we call the stage of the cancer. And it's very important for us to know the stage of the cancer because it will then determine what treatment somebody is then offered and given. In addition to the stage, we also look at the cells within the cancer itself to get an understanding of what those cells look like. And that tells us something called the grade of the cancer. So both the stage and the grade of the cancer we look at from the different tests and scans that an individual will have, and then that helps guide treatment. So the reason why I'm talking about the stage, because as I mentioned, Black women, unfortunately, are more likely to be diagnosed with cancer at a late stage, meaning that either it's larger in size or has spread to other places within the body. And so this information here just gives some insight into that. And I think I'll just have some circles here. And so what this table is showing is a comparison by, again, fairly broad ethnic classifications about a comparison of likelihood of being diagnosed at the late stage of breast cancer. So that stages 3 and 4. And so you can see the proportions here for what those who are white British, it's 15% diagnosed at late stage, Caribbean, Black Caribbean 21%, Black African 27%, Chinese 13%, Asian 17%. And when we compare those with one another, we get something that's very technical, but it's called an odds ratio, and you can see those at the bottom there. And if the odds ratio is higher than 1, it means that there's a higher likelihood. If it's lower than 1, lower likelihood in comparison to what is here the reference group, white British individuals. And so you can see that for Black Caribbean, Black African, that ratio is higher than 1. And even the proportions themselves, you can see, are higher than that for white British, meaning that the likelihood of being diagnosed at those late stages of cancer 3 and 4 is higher for Black African and Black Caribbean women. So what are some of the potential reasons for this? So various studies have looked at why this might be. So there are things that sort of what we call the patient or individual level, and things that are happening within the system that might be responsible. So at patient level, it could be because of things around symptom awareness. So not being aware of early signs and symptoms may mean a presentation at a later stage. Also going to see your GP when things have moved on a bit further in terms of stage. Could be issues around fear, stigma, and negative perceptions of healthcare. So even if you did notice some signs and symptoms in your breast, which I'll come on to later, you may feel not comfortable already, and that might happen more in Black Caribbean, Black African groups, and that could be because of instances where people have had negative interactions or negative encounters with healthcare. There could be practical barriers. So sometimes it's just difficult to get an appointment to even discuss or talk about any symptoms that you are having. And also, as I mentioned about the grade, so the types of cells within the cancer, there may be less favorable, so higher grade tumor characteristics of the breast cancer themselves. And then within the system, it may be because Black Caribbean, Black African women face more significant delays in being referred to hospital from the GP. It may be because we're not having sufficient education around breast cancer, which thankfully Kind of Health Hours are trying to address. And also training for healthcare providers. There may not be the cultural competence to understand when somebody is coming with signs and symptoms. There could be language barriers, misunderstanding in how the person's explaining the symptoms that they're having. So it could be a whole combination of different reasons, which mean that for Black African, Black Caribbean women, unfortunately, we are diagnosed at a later stage, or we're found to have later stage cancer at diagnosis. So what does that mean for us? What types of actions do we need to be taking within our communities? So first of all, I'll just talk about survival. And when I talked about in my earlier slides about 76% of those diagnosed with breast cancer survive for 10 years or beyond. You can see in this graph here how that relates to the stage at diagnosis. So in the darker color, you can see survival after 1 year, 1 year after diagnosis. The sort of orangish color after 5 years after diagnosis. And then on the horizontal sort of x-axis, you can see the stage at diagnosis. And so you can see that for stage 1, it's almost 100% survival after 1 year, just below 100% after 5 years, but that decreases the higher the stage. So for stage 4, if you're diagnosed, if you're found to have stage 4 cancer at diagnosis, the survival is unfortunately lower. And so the earlier we can diagnose cancer in those stages 1 and 2, the much better survival. So really, we're thinking about what we can do within communities, what we can do within the system to make sure that Black women are diagnosed at those earlier stages of cancer, breast cancer, to improve survival. So some of the things we need to address this, so awareness of early signs and symptoms. So I'll come on to that shortly, but really it means us getting to know our breasts, doing regular checks of our breasts ourselves so that we can pick up those early signs and symptoms. For those who are eligible for screening, making sure that we're encouraging those in our communities to take up the offer of screening, and really the system to make it as easy as possible for people to attend screening appointments. And then really this is again as a system level factor, prompt referrals. So when somebody does go to their GP with signs and symptoms that could be breast cancer, making sure that they're referred promptly for further investigation. So I'll come on to checking our breasts or our chests. And for me, this is really, really important because when I come onto screening in a moment, screening eligibility is at older ages for good reason, and because the likelihood of being diagnosed with breast cancer increases with age. So the screening age is higher. But for those who are not eligible for screening, it's really important for us to know our breasts so we can pick up those early signs and symptoms as quickly as possible. So how do we check our breasts or our chests? So in NHS guidance, you'll see that there's a recommendation to check your breast or chest regularly about once a month. And that's to look for any signs or symptoms that could be breast cancer or other conditions. So that's really important. So about once a month, having a look. And it's really important to know what looks and feels normal for you so that you can recognize when something has changed or looks different. So I think it's really important to get to know ourselves in that way. And it may not be the most natural thing for some people, it may not feel like something that you would usually do, but I would really highly recommend knowing what looks normal for you in your breasts. Um, just a word that, your breasts may look or feel different at different points in your menstrual cycle. If you are pregnant or breastfeeding, your breasts may naturally look or feel different as well. And after the menopause. So these are times when things may naturally change anyway. But again, as you start to check your breasts more often, you will start to recognize and see that for yourself. So in terms of the checks, first of all, before touching anything, it's important to have a look at your breasts or chest in a mirror. And again, that's just to get an understanding of what looks normal for you. Then in terms of after having looking and feeling around each breast or each side of your chest, and the recommendation is just do that in a circular motion all the way around the breast up to the collarbone and into the armpit as well. So just having a feel there to pick up any changes or differences that might have occurred. And then also to feel the nipple as well, because nipple changes, which you can see in the diagram, may also indicate that something may be happening. And in terms of how you do this, depends on your preference. Some people will do it standing up as they're looking in the mirror. Some people might do that in the shower, may feel comfortable. Some people may feel more comfortable doing that lying down. So really up to you. But for the looking, you may want to be standing up to look in the mirror. But then for just touching around the breast, up to collarbone, into the armpit, around the nipple, do what is comfortable for you. And then in terms of what you're looking for when you're looking in the mirror, when you're feeling the breast, you can see in the diagram here, I hope it's visible. But first of all, when you're looking for any skin changes, so any puckering or dimpling in the breast. we usually hear about breast lumps being a sign or symptom of breast cancer. So you're looking for any unusual lumps or thickening. Around the nipple, in particular, looking for any rashes or crusting there. If you notice, so this will come from looking and becoming more familiar, that there's a sudden unusual change in the size or shape of the breast. Again, that might be something you want to get checked out. In terms of lumps, it's not just in the breast itself, in the armpit, all around your collarbone. Again, you may want to go and get that checked out if you notice something there. If you notice liquid coming from your nipple and you're not breastfeeding, you may want to go and get that checked out with your GP. Nipple changes, so not just the crusting, but if nipple starts to point inwards rather than outwards or changes direction, that might be an indication of something. You may want to get that checked with your GP. And then finally, any constant or unusual pain in your breast, armpit, which is unusual, I'll say, for you, and it's constant, ongoing, again, you may want to get that checked out with your GP. So these checks once a month, pick up any changes, and if you do notice anything that's unusual, particularly as those things that I've just described, you may want to book an appointment with your GP just to explain that you've noticed this change. You're coming to them to see what the cause may be. Okay, so that's really important around the signs and symptoms, picking up early signs and symptoms of breast cancer. And I found this on the Breast Cancer Now website, and I thought this was quite helpful to think about. But thinking about TLC, I'll put a picture of TLC if you like them, as a group some time ago, for those of us who are a bit older. But think TLC, so a way of remembering is to touch. Can you feel anything new or unusual? Look, as I mentioned, look in the mirror. Does anything look different to you? And then check. So touch, look, and then check anything unusual with your GP. So that's just a helpful acronym to remember there. So that's on checking, particularly for those who are not of screening age. But even if you're of screening age, it's important to continue to check. Even if you have your screen, still look out for those early signs and symptoms in between your screening appointments. So on to breast cancer screening then. So as I mentioned, it's this is your invitations will be based on your age here. And so anybody who's registered with a GP as female will be invited for a screen every 3 years between the ages of 50 and 71. And the way you'll get invited for those screens is by letter. So that should come to you. You automatically get that invite if you're between the ages of 50 and 53, and then you'll be invited every 3 years until you're 71. But as I mentioned, in between those screens, please do continue to do those monthly checks as I've mentioned. And so what is the screening? What does that mean? So in the NHS, we use X-rays, and these are a special kind of X-ray called a mammogram. And this is really trying to identify any cancer, any things that we're looking for cancers really that are too small to either see or feel. So those checks that I mentioned, those are things that you might see, the change you might see, you might feel them. But sometimes there are cancer can be present and you cannot see or feel it. So these mammograms are checking for that. And so what happens during your mammogram appointment is that you'll have 4 X-rays. So you have 2 in each breast. And if you've been for an X-ray before, basically to take the X-ray, you need to have what we call 2 plates. So your body, the part being X-rayed, is going to be between 2 plates to get that X-ray image. And so that's what will happen to your breast. In the same way, if you go for a chest X-ray, you'll have those 2 plates. And so you'll have 2 done for each breast. They're performed by a specialist, someone called a mammographer who will be female. And the mammograms will only take a few minutes, and your whole appointment should take 30 minutes in total. And there's lots more information resource available via the link that I've shared here. Hopefully I may be able to send some of the links. And I would say do check those out. If you're approaching screening age, you want to know more before you get that first invitation, please do have a look. There are videos as well of people who've gone for their screens. They explain how it was, what they experienced, etc. Just if you're not sure and you want to, have more information before you go. If you are of screening age, you've received your invitation, you're still not sure, please do check out all of the information just to reassure yourself that you can go for your screen. And as I mentioned, it's really, really important to pick up those cancers at those early stages possible to improve survival. So sorry, I like charts. This may be the final chart that I show you. But really the reason why I showed this, and I showed this last time as well, is because I think it's important for us to be aware that during the COVID-19 pandemic, because we couldn't move about freely and see each other face to face a lot, breast screening, what we call coverage, so the numbers of people who were screened between particular screening ages and times, it did suffer, unfortunately. So you can see that blue line there, way back in 2013. Nationally, breast cancer screening coverage, so the proportion of people going for that was about 76.4%. That was continuing to be quite stable. And then you can see in 2020, there was a sharp decline in that coverage, and we're just about recovering from that. So we're getting back up into sort of the higher 60%. Hopefully we get back to the 76% kind of on that trajectory. So it's really important that we catch up and get this coverage so that as many people are having their screens as possible. So as I mentioned, if you're approaching screening age, please get all the information necessary. Really encourage you to take up that screening invitation to have your screen. If you're of screening age, you haven't been for your screen yet or responded to the invitation, please do respond and get all the information that you need so that you're comfortable to go for that screening so that we can nationally recover in terms of overall coverage of screening. So I'm almost finished talking, so I've done a lot of talking now. But the final bit I just wanted to mention was just general prevention. So as I mentioned earlier on that slide where you saw about 23% of breast cancers can be prevented. I want to just talk about general prevention measures, which are applicable not just for breast cancer, but for a whole range of things, so heart disease, etc. So some things we can do to reduce our risk: keeping a healthy weight, having a healthy diet, reducing or having moderate amounts of alcohol, and being physically active. So just a few things about that. So first of all, diet. When we talk about having a healthy diet, sometimes people can think that it means we can't eat our cultural foods and we have to, really, not have the things that we would recognize as nutritious meals from our ethnic backgrounds. So I want to just show this diagram here, which is something called the Eat Well plate. Some of you may have heard about this before, but there is one that's been tailored for African and Caribbean communities. And so it just gives a bit of an understanding of when you look at your plate and, sitting down for your meal, what proportions of various food groups you should be having on your plate. And you can see there, the vast majority of the plate should be with fruit and vegetables, and then some other sort of starchy carbohydrates, much smaller proportions of protein, dairy alternatives, very little oil or fat, and really almost no sort of sugar or high fat sugar salt food, eating them very in small amounts and less and often. And you can see that in the fruit and vegetables, that includes a whole range of things that we have from our cultural background. So plantain, you can see guava, you can see okra, you can see ackee. So all of those cultural foods are included in that fruit and vegetables. Should be the vast majority of what is on the plate. Then those starchy foods can include yams, breadfruits, plantain, green banana, etc. So again, the next biggest proportion of those type of foods, and then smaller proportions of the proteins that you can see there, chicken, fish, etc. Lower fat and low sugar options of those dairy alternatives. And then, really little, if you are having the oils and spreads, trying to get the unsaturated versions of those. And then those high fat sugar salt foods, unfortunately, things like the patties, the super malts, little and often. It doesn't mean you can never have them, but have them, but much less often than what you would have on your regular plate. And then keeping well hydrated with water as much as possible. So that is a bit about diet. Physical activity, really important to build into what you do every day. It doesn't mean that you have to join a gym. It doesn't mean you have to spend a lot of money. No, you can think about ways of being physically active and building that into your day to day. So here on this slide, you can see the recommendations around how physically active you need to be each week for an adult and older adult. So at least 150 minutes, so just over 2 hours, if I can calculate correctly, of moderate intensity activity. So you can see the types of things that is. That's like brisk walking, swimming, cycling, if you've got a bike or access to a bike. So about 150 minutes of that per week. So, over 5 days, 50 minutes, just a bit less than an hour if you do it over 5 days. Or you can do very vigorous activity. So that's like running, as any type of sports, etc., for 75 minutes per week. So less because it's much more vigorous, or you can build it into your day to day. So you can do a very brisk walk for 50 minutes. So if that means walking to the bus stop, walking to the train station, on your daily commute or wherever you're going, 25 minutes there, 25 minutes back. You've done that and you do that over 5 days. You've built in that daily activity. So it doesn't necessarily have to be something that you use a lot of money for. So that's sort of the be active part. It's very important, especially if we're getting older, to build strength. To at least 2 days a week, do something that is going to keep your muscles, your joints, your bones strong. So that can include things like carrying heavy bags, so you're shopping on at least 2 days a week. If you do go to the gym and you can lift some weights, or even if you have some weights at home, doing that at least 2 days a week. So those, or yoga or Pilates, those types of things to build strength. So not only the keeping active, but making sure that your muscles, joints, bones are there. And the final things, minimizing sedentary time. So, we all like a rest, especially like me, if you have a job where you're at desk most of the day, trying to think about how you build in walks during your breaks. Yeah, it's very important not to be sitting for a majority of your day. And then things that improve balance, especially for older adults. This reduces risk of falls as you get older, etc. So those things that help your balance, so dance, I'm trying to read there, but bowls. I don't know if we in our community do a lot of bowls, but bowls. But those things that mean that you keep your balance in check. And then finally, alcohol. So making sure that you're drinking reasonable levels of alcohol. The recommendation is to drink no more than 14 of what we call units of alcohol a week, and spreading that across 3 days or more. And the diagram here, you can see what 1 unit refers to. So that's sort of half a pint of regular beer if you drink beer, half a small glass of wine, and so on and so forth. So you can see on that diagram. So no more than 14 of those a week, and spread over those 3 to 6, spread it across 3 days or more. And then the final point is there's no completely safe level of drinking, but sticking within these guidelines will help reduce your risk of alcohol-related harm. So I think that is all. I'll stop there. So I've spoken a lot, but again, happy to take any comments, questions. Thank you.
Amazing. Thank you. Oh, you can't see me. Thank you so much, Dr. Mbema. That was such an insightful and important talk. I really, as a millennial, I loved the TLC. I would definitely not be forgetting that. I think that was a good practical way of knowing how to a simple way of knowing how to do those checks to check our breast and our chest. And I think this talk was really important on the um really vital on the importance of regular checking, because even the screenings, I didn't know that they were so far apart. I mean, 3 years is still good, but this a lot can happen in 3 years. So the importance of that, those monthly checks. Because then of course, if you're checking monthly, then you're more likely to know if there is a change. If you kind of know that this wasn't there last month, or this was there before. So I think that was really, really important. Thank you so, so much. And also for sharing the adapted eat well. I don't think I've seen that either. So yeah, it's good to see it's good to see the adapted eat well chart. I think that's really important because then it's tailored to our community, because sometimes they have things on there that like people I don't eat this and I don't even know what that is. So yeah, I think that was really, really helpful to share, and also really good to see what it is that prevents people um from reaching out, and what causes the late stage detection, and the interventions to stop that from happening, and encourage earlier stage, especially like you said at the beginning, that 1 and 2, that's 50%, that's of people will develop some kind of cancer, and so I think it's important, like you said, that especially the preventative measures, they're not just about breast cancer. They are just about, having good, no, healthy lives, and preventing other negative outcomes. So thank you so, so, so much for sharing that, sharing those insights. Really, really grateful. I'm just gonna have a look in the chat. So there's a question from another platform. I think this is being streamed on other platforms, which is also really incredible. So the question is, what's one way communities can support those who are affected by breast cancer? That's a really good question.
Yeah, thank you so much for that question. So I think there are either national or local cancer support groups. So I would say if you know someone who's being diagnosed with breast cancer, maybe they need support. They will also, as part of their treatment package, be have a cancer nurse specialist also supporting them. But if they need to talk to others who've had that journey, please do signpost them to look for their local cancer support group. And there they will meet other people who have been diagnosed with cancer. They may be able to access specific things happening locally for them. So that would be my advice, to signpost them. And also, as we would for our any friends or families, encourage them, support them if they feel that they need. Particularly, I didn't mention anything about mental health here, but if it's affecting their mental health, again, signpost them to look for support, even via their GP, if they need to go and talk to somebody about how they are feeling, etc. Yeah, so those would be my 2 parts of advice.
Yeah, I think that's really important. And I think that's a really important question. While we're waiting for some more questions, I just wanted to maybe ask, or maybe have a bit of a think about how the communities and other communities like churches or mosques or those kind of communities, how we can, again, apart from things like like Khan, which are incredible, but how we can kind of get the ways we can get the message across to like our mums and our grandmas and our aunties, of how to prevent these things, and how to deal with the early detection. I don't know if you had any thoughts on ways in which we can kind of spread this out even more in the communities.
Yeah, I mean, this is something that I'm really passionate about. I work in Lewisham Borough, but
Yeah.
something that we did earlier this year was to fund community, so grassroots organizations,
Hmm.
to think about ways that they would reach local communities. And those are ways that I may never come up with because
Yeah.
I'm not situated where they are embedded in these communities.
Yeah.
So they came up with some lovely innovative things. They did road shows. They brought in health professionals to come and talk within local community venues. And so it's that type of work that I think more of us in sort of local authorities, NHS, need to work hand in hand with voluntary and community sector organisations to really reach people that
Hmm.
we cannot always do from our positions within
Yeah.
councils, etc. So I'm very pro that work, and happy to share learning from what we've done in Lewisham. I'm aware that happens in other boroughs as well. But
Mm.
I think really supporting people embedded in communities to be advocates, to be champions, and to bring in health professionals when needed to
Mm.
add in the clinical knowledge.
Yeah, amazing. So we've got another question, which is why do you think awareness of male breast cancer is so low and how can it be improved? That's a great question, actually.
Yeah, it's a good question. Sorry, and I didn't touch on male breast cancer as well. I think the thing in my mind is really when we look at the proportions and numbers of those who suffer from female breast cancer versus male breast cancer. Female breast cancer is a lot more common. Um, and because, as I showed you, it's a very common cancer in women, and, we're concerned about survival. That's probably why there's a whole load more promotion, awareness raising for female breast cancer.
Mhm.
Male breast cancer does happen, but as I mentioned, in much smaller numbers. And so I think, but you're right, but the person who asked the question is correct. It does not mean that it should be overlooked.
Mm.
And there probably does need to be, I would say, more awareness raising on that side. But I think that's probably the reason for um, the difference between the two.
Yeah. Yeah, no, absolutely. And on I guess on the topic of community, I can see in the chat that Secondnet has shared there is a breast cancer awareness event, a pink party, which is awesome, on the 25th of October in Manchester, and yeah, so to for empowerment to hope and to get to togetherness, and I think that's really important as well, just as what we're speaking about in terms of community and raising awareness and also celebrating survivors, which I think is really important. And hearing their stories and hear yeah, and celebrating them. I don't know if there are any more questions that people have, perhaps on other platforms. Um, if they're not, then I'll just keep asking questions. I think this is a really important topic. I just wanted to ask, what are some of the what's the word? Maybe like myths or misconceptions that you've experienced in your kind of research or experience within this field?
Yeah, I think probably when we're talking about cancer, particularly to our Black African, Black Caribbean communities, I think there is still something about stigma, maybe let me say, where um, it feels that if you have a cancer diagnosis, you know, that's it, and
Mm.
everything's going to be terrible from then. So that's why I really wanted to, at the top of the presentation, really talk about the survival.
Yeah.
That a diagnosis does not mean that that's it. You
Yeah.
can survive cancer.
Mhm.
Um, and so actually the early acknowledgement of something may be wrong, let me go to my GP as soon as
Mhm.
possible. That will help you. It's not something to be shied away from to say, oh, well, I'm not going to pay attention to that because I don't want to know because it means that, something
Mhm.
terrible is happening to me.
Mhm.
Actually, if you notice that difference, you go to your GP and it's picked up or diagnosed at that early stage, you can survive.
Yeah.
And you saw the statistic well over 10 years from your diagnosis. So I think that misconception and stigma is something that I'm aware of.
Yeah.
And I would say on the screening side of things, I think just the not knowing, we don't tend to know what happens beyond the door when you go into your screen. So that fear, I can say, of the unknown is also
Mhm.
something that I'm aware of, that people just don't know what happened. Okay, when I go for a screen, what are they going to do to me? So I
Mhm.
think us sharing our experiences of screening when we go, having those videos, not necessarily the screen itself, but someone on their way to the appointment,
Yeah.
talking about what happened during the appointment, knowing that the x-rays, as I mentioned, all of that just helps people have the information, knowledge, say, okay, well, actually, that's what happens. And so I know that, it's going to be fine when I go in there. I think it's really helpful just to break down or demystify the whole screening experience.
Yeah, incredible. And actually this next question kind of links to that. So the question is, can you get your breast checked at your GP if you can't do it yourself? So if you're unable to do it yourself.
That's a really good question.
Mm.
Now, obviously, I'm not a GP, but
Mm.
um, what I would say is typically we would say, a bit like with the TLC, the check bit, it's usually you go to your GP if you have noticed that there is a change.
Mhm.
And in the along the lines of some of those diagrams that I showed. So you're usually going to the GP not for them to check you, but because you think that on your own checking something
Mm.
has happened. Um, I think that is probably where I would say going to the GP needs to be if you are concerned that there is a change that you've
Mhm.
noticed by seeing or looking or feeling, you then go to your GP and then they can signpost you for further investigations. I don't think that in terms of GP capacity,
Mm.
they will be able to do those checks that I've mentioned for if every person went there for the checks, they would simply be overwhelmed. So
Mhm.
I think I would really encourage you to do those checks that I mentioned on your own. And I mean, it's quite an intimate thing, so I don't know if if people would feel happy or comfortable to have somebody support them. If you do have somebody, a trusted person who can support you in that, but I would say really it's something for you to do. And then if you notice that any of those changes, you then go to your GP. I would avoid going to the GP just for the check if you hadn't noticed anything or were not concerned, because I think it does mean that GP capacity, would be challenged in that way. I hope that makes sense to the person asking.
Yeah. I mean, yeah, it absolutely makes total sense. And then off the back of that, I was just wondering if people, maybe a bit on the flip side, so if someone noticed a change and they were a bit hesitant to go to the GP or, get that checked, I mean, probably a difficult question, is there any advice that you can give such a person who's kind of a bit like, oh, something, I've seen something and I'm a bit
Mm.
scared to
Mm.
get that checked?
Yeah, I mean, I would really encourage you, to take that step forward for the check. I'd really encourage you to do that for all the reasons that I've explained,
Mm.
because as soon as, the sooner you can get it checked,
Yeah.
the better. Now, the things I just, the check and the things I described, they may not necessarily mean that this is a breast cancer,
Yeah.
but they could be potential signs of that, but they could be something else. So if you have skin changes, you could be having eczema, you could be having other skin changes for another reason. But you want to make sure that you've had it checked out so that you know what the cause is. If it does need further investigation for cancer, the GP can refer you for that. If it is not, and it's for another reason, you can get appropriate treatment and support for that. So I think I would really encourage you to step forward if you feel that you need to attend the appointment with a family member or somebody who can um, give you support. So, going to the appointment with you, maybe they wait outside whilst you go in to see the GP. Even if you need that support, don't be embarrassed to ask somebody to come with you because you are a bit nervous and unsure of what that might be like. But
Mm.
my real encouragement is to take that step forward. Um, Really important that any changes that are unusual for you along the lines of those things that I mentioned,
Mhm.
do go to see your GP.
Excellent. Excellent. And I think you mentioned that you would share some resources, but someone's just asking on the back of the self-checking, is there a visual aid that demonstrates exactly how to do the TLC?
I'll look for one. I didn't have something that explained how to do it. There are some other pictures about, what some of the changes might look like,
Mm.
but I'll see if I can find a video. That's a good question, actually. I'll see if I can
Mhm.
find a video that just shows you, as I described, the looking first of all, and then the feeling the armpit up to the collarbone, around the nipple. So if I can find something, I'll try and make sure that it comes via Calm.
That's really helpful. Thank you so much. And then we've got a question from YouTube. She's just asking, is it true that black women density can sometimes prevent some cancers from being seen. Would MRIs be better for those with bigger or more dense breast tissue?
That's an excellent question.
Yeah.
One that maybe I don't feel 100% qualified to answer.
Yeah.
I think we probably will need a radiographer or
Mm,
maybe a breast cancer specialist
mm,
to really answer that question. I'm not 100% sure, but what I will try and work with the Khan team to do is to find some sort of resource that we can, or even a colleague that we can ask and maybe get that answer back to you. Because yeah, I wouldn't be qualified on the investigation side. So this well, I suppose it's a bit on the prevention, but it's more around the investigation and the
mm.
right type of investigation
Yeah.
to identify cancers in Black women. That
Mhm.
is a specific question I will need to seek some support to respond to.
Yeah, that's a really good question. Um, yes, I think the person who asked previously about the TLC. They were saying it might make it easier for those asking if they can have a
Visual
GP
aid,
nurse doing
yes,
yeah, that yeah, absolutely. Yeah.
definitely.
So I think a visual aid, yes, absolutely would make things a lot easier. And then we've just got one other question. That GPs refer patients with family history of breast cancer for genetic testing, especially if the father of the patient has breast cancer. How many are referred among the Black and brown patients in England?
That's a really excellent question. Again, I don't have the statistics for that, but I hope in the Khan team, if you could collate these questions,
Mm,
I can try and make sure that I get back to them. But this one, I'm sure there may be well, let me not say I'm sure, but there may be data available on the referrals. This looks like for genetic causes of cancer for people who are referred for investigations early. I can try and have a look for that information for you and get back to you.
that's amazing. The questions are still coming through, so that's really
Mm.
good. That's just, I think, obviously demonstrates the importance of this talk. Um, so Grace is asking, please may I know if there are plans for educating teenage girls about looking out for signs and symptoms of breast cancer?
That's a really good question, actually. And certainly, if I speak on for my local authority, Lewisham side, I'd say the work that we do with teenagers, young people, is more about that holistic wellness that I mentioned. So being physically active, eating well, so that because if I think about prevention for children, young people, it's getting those good healthy habits, if you want to call them that, as early on as possible. So we focus a lot on the diet, healthy eating, making sure they get appropriate vaccinations. So, for example, the HPV vaccination is so important in terms of cervical cancer prevention. So that's what we do at that stage. Probably not as much though on the breast cancer checking side. So I think again, you're right, it's a good thing to start getting early in terms of those healthy habits that know your body and know what is normal for you, etc. So I think that's something that I will take away, certainly for Lewisham, actually even to take back to my London colleagues about what we might want to do in that sort of holistic prevention space for young women. Thank you for that comment
Amazing.
question.
Such great questions. And again, I think that reflects just the importance of this topic, and just how inspiring you're talking. There's a lot of feedback to say that the talk was really inspiring, and a lot of gratitude for the talk. So thank you so much, Dr. Mbema. It's been fantastic. I think this is your third Khan talk.
Yes, that's right.
Yes, or your third Khan talk. So thank you so much. I'm just going to hand over to Wise.
Thank you so much, Dr. Catherine. It was an absolutely fantastic presentation. I learned so much. It was very, very insightful. Really, really enjoyed that. So yeah, my name's Wise. Just gonna close up the session today and just run through a few slides of what's happening at Caen in the coming weeks, and just to show some stuff of interest. So just give me 1 second. Um, Hopefully you can see my screen and share it. Yeah. So we run our health hour sessions every Saturday at 11 to 12. It's just we do different topics each time, and it's a really good opportunity for members of our community to learn a bit more about the health issues that affect our community. And next week we'll be having guest speaker Dr. Oge Azuli, and she'll be covering change of weather and spread of disease and so on. So yeah, just feel free to register, and we hope to see you next week for the health hour session. Next we have our upcoming Black History Month Gala at the Concord Centre in Manchester. It's going to be an incredible event to celebrate the work that Black professionals, in the medical industry do for our community. It's going to be a very special black tie event to celebrate their outstanding achievements and awards, amazing cuisine, and a really good opportunity to network as well. We would love so much to see you guys all there, and just to get to know you guys a bit more. But yeah, tickets are still available. On our social media, it's there as well. We're promoting that too. So just feel free to find the links on there and join us. That's next week, Saturday. We look forward to seeing you guys there. And yeah, the pink party we're having on the 25th of October, it's very closely linked to the session we've just had. It's about breast cancer. It's about raising awareness, and it's going to be in Gorton, which is really good location. And we're going to have fun activities, prizes, games, very very important health talks, similar to what you just heard from Dr. Cathrine. And yes, we would love so much to see you guys there to hear the inspiring stories, have some interactive sessions, and it's going to be a really really good session to be a part of. And next we have some workshops basically about women's health, and it's something that's very, very, it's a very small focus groups kind of. We provide travel support for these as well, refreshments, and very small groups, 8 to 10 people, and it's completely free. We just really want to get people to come along to these and have people to obviously benefit from the advice that we will provide at those sessions. So we would love to see you guys there. Feel free to scan the QR code and then contact Dr. Sakinat for any more information. And we have the Black History Month Black Leaders Toolkit. It's an amazing collection of information, graphics, and voiceovers about heroes, who have done so much for the Black community across the years. Very, very educational, insightful, and it's all available for everybody to use for free and just to obviously have a look through. Really, really recommend looking into this. It's really like mind open, like what's the word? A mind blowing in a sense. It's really, really interesting stuff. So yeah, completely free resources. So feel free to have a look through that when you can. And thank you so much for joining us today. We really hope to see you guys next week. Yeah, thank you.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.